So as we begin to populate here, I want to say good afternoon to everyone. It is Tuesday, September 15th, and this week's edition of Business Unusual. As you guys know, my co-host and I, Peter Klein, we launched Business Unusual right when pandemic lockdown began, and we thought it would be a good, useful tool for the Long Island business community to have sort of a weekly status update from folks in the trenches, in the key industries, in the key spots, seeing what's going on in their world and how they have helped manage their organizations through this, and what it is that we're going to see going forward. We call it Business Unusual because nothing is usual during these times. I was just asking Peter about the market, and Peter, you said the market's up again today, right?
Yeah, it's not on. It's perfect way to bring this to the forefront with respect to the economic situation and the market itself, but very unusual. And I just finished a video that we did. You can see it on linewealth.com that speaks about manias and financial bubbles, the history going back 300 years. You know, John, do you realize that Sir Isaac Newton in 1720, it was arguably the most brilliant, mathematician of his time, got sucked into the South Sea bubble, lost millions of dollars. Very interesting new book about that. So I did a little bit of a video about how the madness of crowds can suck people in. And I think we're getting to a point right now in certain sectors of the market where it's feeling to me very bubbly. And I'm getting increasingly concerned there. On the other hand, there are some really good opportunities, I like to think, in the area of cybersecurity. Everyone's working from home now. It's a very important application to have. Infrastructure, we need better infrastructure, especially on the water side. John, I suspect you'll be able to speak to that. And of course, I also think the biopharmaceutical area is going to go through a real golden period, not to mention gold.
Yeah, cash and gold, right, Peter? Cash and gold, my man.
A little bit other things, but yeah, for the most part, a lot of defensive posturing right now.
Yep. So today I'm super excited to welcome my good friend John Flanagan to our show. I've known John a long time. John served a very distinguished career, more than 30 years in government. He held the very prestigious positions of both Senate Minority Leader and Senate Majority Leader here in New York State. John has been an incredible friend to Long Island business during his entire career in government, and recently he made a COVID pivot, shall we say, to the private sector. Joined Northwell Health. Now I'll tell you, John, I have told the story many times. In fact, I just said it this morning on an HIA call that I have, that here in New York, it was the Omaha Beach in Normandy of COVID impact, right? We got hit, we got shellacked, unlike any other place in this country, for sure. And it was Northwell who was the front line. It was Northwell who took it on the chin for us. Your organization, your workers, your healthcare professionals dug into those trenches and really were able to withstand the onslaught of what we were facing, which was something we'd never faced before, and the data and the information that other states and other healthcare systems were able to glean from Northwell helped save tremendous lives here nationwide. So on behalf of the entire business community, we want to make sure that we start out by saying thank you to you guys at Northwell. Thank you really for the extreme leadership that you guys have shown during this time. We on Long Island are very grateful. So I wanted to make sure that I mentioned that. But let's turn to you for a minute, right? So 30 plus years in government, and you decide to go to the private sector. What was that process like for you? What were you thinking, and why the move?
Well, first of all, thank you so much for the kind words about Northwell, and I'm sure we'll speak more at length about the people that are here, especially about Michael Dowling. And I have the blessing and good fortune of being here. And interestingly enough, the person I knew the best before I came over here was Michael Dowling, because I'd met him over 30 years ago through then Governor Mario Cuomo. But Joe, and I really appreciate again the words about the work that I was involved in. It was absolute pleasure and privilege to do that kind of work for as long as I did. But I did feel like it was time for a change. I was had a longing for public service. My father was in the legislature. I had a wonderful career. I really had a wonderful career. Met tens of thousands, if not maybe hundreds of thousands of people throughout 33 years. And I wanted to try and do something different. And I was given this opportunity, which is kind of a neat segue in the sense that healthcare is a lot about government. A lot of the funding that comes into healthcare comes from governmental sources. And, I would just say I'm very grateful for the time I had in the legislature. But in terms of my life, I thought it was a good chance to take a step aside and let other people pick up the mantle, if you will. And it's worked out very well, certainly from my perspective.
Yeah, I mean, they're certainly lucky to have you. I think what's interesting is we're finally seeing, at least in our generation, I'm sure in our grandparents' generation, understanding the important role between government and health and safety of a community, right, is critical. And we've never had to see before governors and county executives make calls as it relates to healthcare and have to work so closely with the healthcare system. So that must have been a really good perspective for you to have being part of the system at this point.
No question about it. There's so many people that I've worked with through healthcare all across the state of New York, different systems, different leaders, but coming here, I couldn't agree with you more. There is, and I do, in reading a lot of different things, I do have to say, even as someone who is steeped in decades of service, I don't think I understood, and I was involved in this stuff legislatively, I don't think I properly understood the depth and the scope of what hit the state of New York and what hit Long Island and what hit Northwell. There's a book that I finished reading written by Michael Dowling called Leading Through a Pandemic. It's unbelievable. It's a good, quick read. It's chock full of details, but I'll give you an example. We have a lady named Phyllis McCready who is in charge of procurement. She buys everything for this system, including all the PPE stuff, the master gowns, everything else. She started seeing problems back in December, when shipments were stalled and things like that. So all these things crept up. And I almost analogize saying, it's like you and I are at the beach and we see it's a choppy day and say, wow, the waves are coming in. And all of a sudden, a tidal wave comes in. And even if you think you're prepared, you're not necessarily prepared. I'm saying that from a governmental perspective. So it was a tidal wave of things that hit all at once. But your point is so apt and so important. If there were not governmental and intergovernmental cooperation between and amongst various levels of government and the healthcare systems all across the state of New York, this could have been way worse. But the governor relied very, very heavily on Northwell, and I think he made a wise decision in doing that.
Yeah, I know, being it's a national election year, and we're not partisan at all on the show. We just talk about policy. But I know both sides were sort of gritting their teeth and getting their ass burned that they had to cooperate through this whole thing. But I tell you what, here in Suffolk County, it was very refreshing to see Republican congressmen assisting, Democratic county executives and other leaders and vice versa to be getting things done here, because health and safety is the priority. And I think because the economic times were so good, we forget that. But I think it really saved tens of thousands of lives here, the cooperation between the systems and the elected officials that occurred. Do you agree with that?
I do. And I think the governor, let's go back. The governor played an extraordinary role in this. He, for whatever the reasons were, he just decided, I'm going to get out there, I'm going to be in charge, I'm going to have a commanding presence, and I'm going to give people calm, I'm going to give them reassurance. And a lot of the legislative action that took place gave him extraordinary authority. Sometimes people chafed at that, but in retrospect, I think it was particularly helpful. especially as it relates to healthcare. So if I look from a different perch, so to speak, governor did extraordinary things. I think a person who has really, in my opinion, been unheralded is Senator Schumer. Senator Schumer is a vintage quintessential New Yorker. He's in there plugging and pushing and saying, we need money here, we need money there, we need money here. And at the local level, our county executives have been very outspoken and been very, and I mean that in a good way, cooperating with entities like Northwell, relying on us for testing in some of our poor communities, communities that were much more adversely affected. So yeah, I think on the whole, I'm confident on the whole that there's been extraordinary cooperation. And there are plenty of living examples. And I'll say, I want to give a plug really for the type of things that your organization has pressed for incessantly. If you can't give tax cuts, you can't give that type of relief, stop burdening businesses. We've talked about this many, many, many occasions. The regulatory environment, it's killing people and killing business across the state of New York. That relief is absolutely a focal point and critical component of what was able to be achieved. We need to learn from that, and this is all in the book. If we don't take stock of what happened, we don't see the relaxation of burdensome regulations, it's just going to go back to the way it was, and it doesn't need to. We can make extraordinary changes for the business community, not just healthcare, for the business community by saying, this is a perfect example of if you give flexibility, you can still hold people accountable and protect the public at the same time.
Yeah, I think, and Peter and I have talked about this a lot. I think with the, with the good news of the market, the bad news is the amount of debt the country has right now and the amount of debt that the states are going to have. And I think we're going to be forced to recreate every state in terms of how they are looking at business and how they are going to be taxing businesses moving forward. It's just going to be an economic viability and reality.
There's going to be issues to be contending with, but I wanted just to sort of, besides the capital and the money to go into these different initiatives when we were in the midst of it all, and let's hope we don't get back to that. There's also the leadership, and John, I thank you and your team, of course, and folks like Joe and other business owners here on Long Island. But Michael Dowling, I mean, he was in front of it all. He was right there with the governor, and he was just, and then that inspired his people to do the extra. I mean, let's face it, if you're an emergency room, healthcare professional, you're on the front lines. You're scared. You can't go home to your kids. You're not even sure what to do. It's St. Patrick's Day. It's the weekend, whatever it is. It's middle of March, and you are frightened, but you're going to work. You're there. You're stepping up, and that to me is truly, truly admirable. And I think it comes from the top. And I think it's Michael Dowling's way of inspiring his people.
If I may comment on that, first of all, I agree with you 1,000,000%, not 100, not 1,000. And the whole executive team here, they have been extraordinary. Again, reading what happened, the flexibility, the culture here is essentially, nobody says no. If Michael Dowling and Mark Salazzo and the senior leaders in this organization say, you have to be in New Rochelle by dinner time, they go. If you have to go and do things internally and not rely on outside labs and create stuff internally, they do it. If you have to put aside your egos and your experience and your credentials and everything else and collegially work under the most extraordinary and extenuating of circumstances, that's what happened. Those frontline workers, they were absolutely buoyed by the fact that Michael Dowling, he wasn't off out of state. He was right there on the front line.
Yep.
And frankly, that's who he is. That's who he is. And I have to tell you, I've been so extraordinarily impressed with the mission. 77,000 patients were treated, 17,000 inpatients. You have people internally, 17,000 inpatients. You have people who say that conference room can be used for beds. That administrative office can be used for beds. That cooperation with the Department of Health in the state of New York made a vast difference. You have construction people, you have nurses, you have technicians, respiratory therapists, everybody who does this kind of work, everyone got together And I had a very good meeting last week with Dr. Kathleen Gallo, and she's one of our senior executives. She simply said, we all work for each other. And that comes from Michael and that team. So I'm grateful that you were kind enough to recognize that. He's very inspiring. I mean, I have to tell you, for me personally, a great catalyst for joining Northwell was the fact that I would be able to work for him and be part of this team.
So, John, talk about Northwell. I don't think people understand the size, the scope, the depth, and the breadth of Northwell. But give us a sense of what sort of organization it is.
It is extraordinary in its scope and its breadth and its depth. And we are the largest private employer in the state of New York, approximately 72,000 employees, 23 hospitals, about 800 ambulatory sites, which is basically everything that is non-hospital. We have this incredible warehouse, literally a warehouse that does all the ordering. Our purchasing department, the budget is close to $4 billion. They buy everything. We have, I believe, the largest clinical lab in North America. We have a scope of medicine and practice that I'm learning every single day, experts in their fields. What I think I would say is it's a very large system. It's obviously gotten extraordinary notoriety because of Michael Dowling and what has happened and the leadership that's been demonstrated. But Joe, I'll give you an example. I think people look and they say, Northwell's big, they're really big. And then they say, well, you know, Michael Dowling, great, and the leadership team, but we're everywhere. We're in every community that you can conceive of. And where I am now in the Eastern region, the footprint is going to grow a lot more in Eastern Nassau and Suffolk County. So I would say we're big enough to have economies of scale, but small enough that there's a very strong community feel. I just came from a ceremony for the dedication, believe it or not, of a parking garage at Southside Hospital, 1,000 parking spaces. Not the most scintillating thing, but it is absolutely critical to the mission. And Southside has had exponential growth. Their reputation is sterling and getting better every day under the leadership of Donna Moravec. She's just one of many examples of the people that are there. So what I would say is people know that Northwell is very large. But what I feel part of my obligation is to help people understand we're your neighbor. We're right in that next door community. And this place is beyond diverse. If you ever had a chance to scroll through our directory, there's not a lot of people with the last name Jones and Smith. We have an array of people from every ethnicity that you can possibly imagine, every nationality. So I am enthralled by the notion that I can be part of an organization like this, but it's always moving. So they're big enough that they have those economies of scale, as I said. And Joe, I'll say one thing in particular. The part of the leadership was being able to say there was a very serious problem in Forest Hills, or a very acute problem in Valley Stream, or the tip of the iceberg hit Huntington Hospital. We could move people around and shift our resources so those economies of scale save lives. Bottom line, and save lives. And the governor in particular had such faith in the team that's here that he called upon Northwell time and time and time again. So it's interesting for a person like me, I was coming in on the tail end. But I will tell you the things I've read, and I think this is really important, and this is through healthcare generally, but at Northwell, the folks that I've spoken to that have 20, 30, 40 years experience, basically to a person, they say they have never seen anything like this. Imagine going into a hospital, never seen anything, and these are people who have seen virtually everything, exhausted emotionally, physically. You go into a hospital, there's no visitors. You go into a hospital, the activity is so eerily quiet that you hear ventilators. You hear people are not moving. It's surreal. And I only learned this by listening, most importantly, but by reading some of the stuff that's in this book. Again, leading through a pandemic. It's really just amazing to me. And I would say the professionalism that has been displayed by these the line people that you were talking about, Peter references, people staying in hotels so they don't potentially expose their family, people working 16, 18, 20 hours a day and going right back in. That stuff, it got notoriety, but I have to tell you, I'm not sure it really got enough because these people never let up. Now, I'll tell you one other thing that's really important. If you look at the backdrop for all this, the people at Northwell have been planning this stuff for years. You take a Mark Salazzo, a Gene Tagney, a Joe Mascolo, these are leaders. They have a command center, there's a crisis center, there's a whole series of planning events that took place before this. Now, I live in Huntington. Nick Fitterman and the people at Huntington Hospital, like every other hospital, Peconic, Mather, Southside, Syosset, Plainview, Glencoe, all of our hospitals, they're all planning for the next wave. They're doing everything they need to do, and they're hoping with every breath they take that they don't have to do any of it. So it's a long-winded answer, but I got to tell you, there's so much going on. I feel like I'm only scratching the surface.
Yeah, no, this is great stuff. It's great stuff for the business community to understand. I know we just don't understand the complexities of healthcare and the importance of partnerships and collaboration. One of the things that I'm super proud of, particularly as I wear my HIA-LI cap, is the fact that we were hit so hard, yet we didn't lose one person because of lack of a ventilator or any other sort of medical equipment, right? And that was private-public partnerships coming together very quickly to pivot. And one of the things I know you guys were able to do was really improvise and find creative ways to make sure that you were servicing your patients as well with 3D printers and actual garden hoses and all sorts of ways you had to get things put together, right? Which is really kind of cool the way you guys were able to do that.
There's no question about that. You have, and it's not just the doctors, it's a whole set of people in the field who it's sort of like you're given your chance. Someone says, you know what, you have to innovate instantaneously. And they did. They absolutely did. So you could take a gentleman like Kevin Tracy. Kevin Tracy is a neurosurgeon. He's the head of the Feinstein Institute, beyond intelligent. He and his team were making sure that there were clinical trials being done all throughout this, as arduous and burdensome as that was, to make sure that we had the right amount of information and all the requisite data to have a better understanding for what may come. Because the people who pay attention to this stuff, they say, this kind of thing is going to come again. We don't have to know exactly when, but it's going to come. And I will tell you this, another component of this, and as a person who worked in government, I really paid attention to this. The leaders, including Kevin Tracy, say there's not enough respect for science in this country. Whether it's the NIH or the CDC, there has been systematic underfunding, and we have not planned properly for events like this. When it comes from somebody like that, of that caliber and that ilk, and working with the people that you referenced, that to me makes all the difference in the world. But yeah, we had people literally from a 3D printer figuring out how to do stuff. Now I'm going to go right back to the HIA, and I think this is because I'm trying to think. This is to your audience. These are to your folks, people that I have deep respect for. One of our biggest problems was reliance on places like China and India for PPE equipment and all things like that. A greater reliance too was on pharmaceuticals. I read something today that I found astounding in the sense that if there had been this type of massive problem in China and India, we might not even have the pharmaceuticals for the people here in the United States. So what do we do as a state? What do we do as a country? How do we make sure we never get in this type of situation again? And if that means we have to, as governmental entities, incentivize to keep business here, or more importantly, perhaps get rid of some of those crazy regulations, reduce the tax structure, and provide some ancillary benefits to businesses that are trying to grow, we have to make sure we're not in a situation where we are relying on foreign countries in a time of extremis. And I think of, it's close to 55,000 employees, I think, in the HIA. We have a number of manufacturing facilities still there. Why can't we be doing things that says, okay, for Long Island, we don't have to go We don't have to go to Jersey. We don't have to go to California. We don't have to go to Mexico or the Philippines or China. Let's find ways to incentivize that work gets done here. And that's that type of discussion has to take place. And I'm hopeful that the governor, our business leaders for sure, and Joe, again, that's the thing. We have to do these things. So I look at Peter, right? The clients that Peter has. I think of as an aside, what's going on with the tax structure in New York? We have to make sure that we don't have people leaving.
Yeah.
People are leaving. And the people who have some wealth, they can go in a nanosecond.
They do.
If we don't make some of these adjustments, Peter's going to be talking to clients in Connecticut and Florida and Georgia and other states. So it's not a one-dimensional approach, but on the healthcare side, I have to tell you, again, I'm going to tout it because I can. The book Leading Through a Pandemic, it is chock full of real-life stories, and the collegiality demonstrates that if people are given a chance to innovate, they'll do it. They'll do it.
The other thing is that, and Northwell is probably, most folks, know of them for the hospitals and such, but you guys also do very substantial research. Can you speak to the efforts of, I guess it's Feinstein and others? Because I know that with Cold Spring Harbor Labs, you guys have done some great partnership work with them.
No question about it. This type of thing, Peter, builds on itself. If you go, we have the Sandra Atlas Bass campus, we have the CATS Institute, we have a whole series of places where there have been philanthropists and benefactors who have decided that the work we do is important. Sometimes it may come from a personal story or history, and that's okay. But I was over at Feinstein, and I know certain things about myself. I can't be a doctor. I don't have that skill set. I don't have that acumen. I probably don't have the stomach for it. The people who do the research, Dr. Tracy is a neurosurgeon. And when I sat with him and listened to him and the people around him, it's exhilarating, because these people are so smart and they're so dedicated. Like I said, while in the midst of all of this, I mean, truly a pandemic, it's mayhem, but in a controlled way. They're in there saying, we have to do this research. We have to find out, they looked at comorbidities, things like obesity and diabetes, and how that manifested itself and why that was so prevalent in the people that unfortunately didn't make it. That's all extraordinarily important. I'll go back to what I said about the science component of it and actually investing in the research, whether it be in cancer or things like this. Yeah, I think the people here would be justifiably proud to speak. Do I know every nuance and detail? No. I'm learning more every single day, but there's hundreds of millions of dollars. Look, when I was majority leader in the state Senate, working with people like Michael Dowling and Northwell and the LIA and entities like this, I was involved in agreeing to $50 million coming to Feinstein, as well as places like Cold Spring Harbor and other entities. And you're right, the collaboration with Cold Spring Harbor is critically important. And that, I think that type of thing will grow on itself. But if I'm going to be sort of an emissary or an ambassador for Northwell, those are exactly the kinds of things that I want people to know. And
sticking with that, Joe and I were just talking before at a prior call about, taking a sort of a page from Emmanuel's book about, never letting a crisis go to waste. And, again, this is a tragedy unto itself, but maybe something special could come from this. And maybe we could look back and say, oh, that was the impetus in creating some kind of bio hub, some kind of effort here on Long Island to show and to sort of bring together all of the great resources we have, from Northwell to Cold Spring to Hofstra Med School, Stony Brook, and and Brookhaven. We have such great brains here and great minds. We've got to figure out a way to sort of bring them all together and make something sustainable happen here on our islands.
Well, I couldn't agree with you more. And you made a couple of distinct examples there. I mean, I know of efforts in my legislative career with Cold Spring Harbor Labs, Brookhaven National Labs, and other entities across Long Island. But yeah, that collaboration is extraordinary. But I will also say, just given the size and magnitude of Northwell, a lot of that is occurring internally. I'm not saying to the exclusion of anything else, but when you, these are not small entities. You know, if you drive around on the North Shore campus and Manhasset and everything else, just Feinstein plays a pivotal role. But that's the kind of thing that people respect. They may not know it to the level that you and I would like them to, certainly what I would like them to, but I think that's part of the message that we need to deliver. And you're right. No one wants to be in this situation, but if we don't take that proverbial deep breath and say, all right, what went right, what went wrong, and now that we've been given this chance at innovation, what are we going to do? Now, this gentleman named Jeff Krapp, who's one of our senior leaders, he has been extraordinary in analyzing these types of things. And again, going back to the regulations, a lot of things were outdated in terms of regulations because of technology. There were a lot of rules that prevented medical professionals from coming in from out of state. In a crisis like this, all the rules go out the window temporarily, because we do have to have safeguards and guidelines and things of that nature. But the ability to now say, what can we do better? You're an expert in the markets. You know, you could, with your eyes closed, explain to somebody like me what goes right, what goes wrong, and where things need to be different. I think the market, thank God, has ways of correcting itself far more efficiently than government can do so. But, you know, if we're looking at governmental policy, there's an extraordinary amount of money that comes from governmental sources. And see, here's my philosophy, and I think this is why I think of Joe and the businesses. I feel like a lot of business people are very comfortable with the notion that government is going to say, we have to have some rules, and we're going to collect some taxes. But in my opinion, for far too long, government has focused on inputs instead of outcomes. Government has said, one person did something bad, so now 1,000 people are going to have 49 new rules that they have to live with that had no efficacy and no value. If we really take a look at this, what regulations, if we're talking about education, what does that mean for a student? Or what does it mean for a teacher? If you're talking about transportation, what does that mean for the riding public? If you're talking about healthcare, what does it mean for the patient? If you have a pediatric unit and the law says you're not allowed to have adult patients in there, but there are no kids in there, and you have a crisis, why should there have to be special authority to take adults and deliver appropriate care in an alternate setting? Hold people accountable, make sure there are proper outcomes, but actually have the faith in the people to do the right thing and to use their expertise individually and collectively, not only in the Northwell system, but healthcare generally. I would imagine, Peter, in your line of work, you could probably come up with 10, 15, 20 regulations that impede your ability to do business that you know don't benefit your client one iota.
Yep.
Why can't we have that discussion? Why can't we actually say, okay, we've now been given this crisis and this opportunity to reevaluate everything?
Yep. I think
don't want to lose that chance.
No, it's great. So, John, what is your role? What is your day to day at Northwell? What are you up to?
Well, it's a variety of different things. I've traveled to Staten Island. We have 2 hospitals in Staten Island. We have 2 facilities in Westchester. I'm going into Lenox Hill next week. I've been to Peconic, Mather, all of our Long Island-based facilities. My role is government affairs, and I'm assigned to the Eastern region, but I'm doing a lot of work with our Central and Western folks as well. And Joe, as you can imagine, you know, throughout the course of my career, I've met a lot of people, and trying to enhance what Northwell is doing at the local level, interfacing with governments. We had a ceremony this morning. Angie Carpenter was there, the supervisor of town of Islip, who's been extraordinarily supportive of Northwell's efforts, particularly at Southside. So making sure that we have good contacts, that we have good relationships, that we have put a good face on what we're trying to do, all in the right way. You know, you take, I'm supposed to help deliver the message, and we have an extraordinary marketing and public relations department, But Michael Dowling said this morning, we've put $500 million into Southside, and we're now in the next phase of another $500 million. So if I can play some role in working with the business community, if I can play some role in working with not-for-profits, if I can play some role in interfacing with government to help deliver the message and save time, because saving time saves money, that could go a long way. Let me give you, here's something that people don't know. Northwell lost about $1.6 billion in revenue because of COVID. So in a simplistic way, hospitals, if you can't do surgery, that has a significant adverse effect on revenues for hospitals. Now that can be for emergency room procedures, which still generally take place, but you're going in for a hip replacement. Peter's going in for a knee replacement. I'm going in so they can finally give me a heart. So, you know, those type of things, those are extraordinarily important to the financial well-being of a hospital. And that feathers out. If the hospital is not viable, that has an adverse effect on the impact on the surrounding community. So Northwell has been made partially whole by governmental funding, but we are clawing back like everybody else. And if we didn't have the wherewithal, and quite frankly, the leadership that we do, this would be much, much more difficult. Smaller regional hospitals, not necessarily on Long Island, but in other parts of the state, very, very difficult because they don't have the economies of scale. They don't have the flexibility. So Joe, I feel like I've been given a strong opportunity to learn. And I'm not buttonholed into any one thing. I'm looking at this as I'm supposed to play the role of just being a great emissary on behalf of the system and grow it in any way possible. And by the way, that means working well with other people in the healthcare field, which I've done throughout my legislative career. Find ways, as Peter spoke to, what can we do with Cold Spring Harbor and entities like that? It's very, I have to say, it's brand new still, and it's exciting. I could read every day, pretty much all day, still not catch up. But that's okay.
I think it's great. I think it's a great opportunity for you, John, because you always were willing to reach across the aisle and try and build bridges to get things progressing. I'm just curious as I'm thinking about it philosophically. So, as majority leader and minority leader, you and especially being from Long Island, you had to butt heads a lot with the governor and his administration on funding. But yet now in the private sector, you're in a position where you can empathize a little bit more of the needs of these healthcare systems and federal funds that we need to get to the states to help you guys out. So where are you in all of that? I'm curious.
It's a really good question because, you know, I'm not by any stretch saying I bring a perfect set of eyes, but I bring a fresh set of eyes in terms of, you know, what healthcare funding is like. So we have a gentleman, two people, Howard Gold and Gus Costales, who work on managed care. They are extraordinarily involved in contracts and negotiations and things like that. So as a legislator, you say, well, managed care must be good, right? I mean, it's managed. We want something that's going to be properly taken care of. It's just not that simple. So, yeah, do I see both sides of the coin? Do I have a different perspective? Yes. Do I think if I were to focus on one thing, it would be the constraints that health systems, not just Northwell, but that health systems have to operate under. Let me be clear. I don't believe for 1 second that Michael Dowling or anyone who works here wants anything less than stellar care and protections and guidelines and rules and safety nets for people. But you've extolled his virtues. Peter has as well, his leadership. You know what? Hold us accountable. Provide some of that flexibility. And yes, did I work with the governor? Clearly. Did we have our tete-a-tetes on a lot of different things? Yes. But at the end of the day, even though we're in election season, you and I both know this. The day after the election, people want to know, what are you doing for me? What are you going to do to make my quality of life better? How are you going to help my property taxes? How are you going to make sure that I can get to a hospital? How are you going to make sure that my roads are paved and my garbage is taken care of? So people's expectations about government, I have a very keen sense of that, and I do appreciate the kind words. I feel like one of the things I've done well and tried really hard to work at is actually listening. So when you and Terry and your board and the people involved in HIA talk about the scope and size and magnitude of the HIA relative to the rest of the country, we should listen. When you talk about the manufacturing component, we should listen. When you talk about IDAs and investments and making sure that we have viable opportunities for businesses, we should be listening. There should be a synergy between an entity like Northwell and the HIA. And quite frankly, your leadership, meaning you as Joe, I've told you this independently, I'll just say it flat out. I have great admiration and respect for you and the people who serve, because none of you have to do this. You're not conscripted to do any of it. So we owe you a fiduciary duty, not just, and I'm talking about government, but I think in healthcare as well. How do we help? Because you're a business owner. You run a small business. You want good quality healthcare for your employees. You want to take care of them. You want to do the right thing. We're supposed to be part of that.
Yeah.
So yeah, I do have a different perspective.
Yeah, it's a huge part of Long Island, right? It used to be school districts, and now it's school districts and healthcare and law enforcement, right? And so we're seeing a lot of other places in this country suffer, right? They don't have the healthcare infrastructure in place. They don't have appropriately trained law enforcement and funded and staffed law enforcement. They don't have all these things, but Long Island and Suffolk County in particular, and Nassau as well, we're doing really well during all of this, notwithstanding having been hit hard. But a big part of it is healthcare, right? Healthcare has to do well. And it's a concern of mine, and I'm sure of the business community, because like you said, for us to remain competitive, our workforce has to be here. And healthcare is a big part of remaining competitive, especially for attracting workforce, right? And so how is Northwell facing that challenge, especially if businesses are losing, especially you guys, no healthcare system can make money on Medicare alone. They just can't do it, right? They need insured, they need private pay, they need all this stuff. So how are you guys, being so large, staying small enough to make sure you're addressing those issues?
That's an excellent question, and that could probably take days to answer, even with the fact that I've only been here 3 months. You know, I would say there's a heightened sensitivity to the mission. So I always, when I was a state legislator, I used to say, if things are going well in Suffolk County, that's good for Broome County and Clinton County and Cayuga. Correspondingly, if things are not going well in Rochester, that has a negative effect on Long Island. So if I just look, say, at Suffolk County, if things are going well in Riverhead, that bodes well for Bayshore. If things are not going well in Central Islip, that doesn't help the East End. That doesn't help Brookhaven. So it's all goes together. The size certainly is incredibly important, but we have people like Dr. Deb Salas-Lopez, who's the Senior Vice President for Community Health. We're taking a really hard look at disparities in healthcare, disparities in access to care, disparities in delivery of care. And when you look at COVID, if things are acute in Huntington Station or in Central Islip or Brentwood or in other communities, we go right in. We work closely with the counties to make sure that we do that. But it's a lot of work. It is a lot of work to figure out, where do you run to? Like, where is there a brush fire and where is there a real fire? And where do you take the time to make the investments? You and I have spoken about the HIA. I look and think you have a number of manufacturing employees, some of whom are on the lower end of the pay scale. How do you help them? How do those companies protect their workers? Do you do more things with telehealth? Do you have mobile vans that go on site and deliver some of the services that you're speaking to? But, you know, I think the strongest component of what we have is the mission. So the other part of it about this is, now Northwell is basically a $13 billion entity. But no one should labor under the misimpression that somehow we're sitting on $500 million in reserves. It just doesn't work that way. It's a not-for-profit organization, and because of the management, everything that comes in either goes out the door in terms of services or expenses, or it's reinvested. So when Michael Dowling says we're going to put another $500 million into Southside, that's all things that come from the system. So we don't have a huge margin, and in a year like this, we'll be lucky if we have a margin at all. So it's investment and reinvestment and keeping a pulse on what's actually going on.
It's a critical point, though, John, because a year like this, you're going to have a really difficult income statement. You know, as it is, your margins are very tight. I mean, maybe less than 1%. And that's assuming you have a lot of these non-insurance payable, the sort of hip replacement, knee replacement kind of higher margin operations, which were locked down until probably now. So it's going to be a really difficult year. And I guess I wonder, and fortunately, you've got a wonderful development team, and that development team is indefatigable in their efforts to work with folks like foundations and such. And that's a good thing. But there's going to be a lot of heavy lifting needed to get you guys where you need to be.
Oh, heck yeah. And you may want to go back to something you said. The decision to not continue elective surgery, the system didn't wait for a dictate from the state of New York. Michael Dowling and the senior management decided we have to be prepared for the worst. And in so doing, that was an internal financial hit, because they wanted to make sure that they were doing the right thing with relation to the pandemic. Here's a simple thing, but so profound. People internally started wearing masks before it was really mandatory to do so. And if you look at the statistics as a result of that, we had plenty of people who got sick, but we had far fewer people who got sick because management said, everybody's wearing a mask. Management said, we know we're going to take it on the chin by stopping elective surgery, but we can't have a situation where we're not prepared. We created over 2,000 beds almost overnight. And things that used to take weeks and months, things that used to take months were done in days or weeks. So that flexibility is extraordinarily important.
Yeah, one of the things I'm super excited about you being in this position for, John, is you understand the business community. Yesterday I was talking to Mark Kleinman, and Mark's the president and CEO of Walker's Shortbread, and they have a manufacturing facility in the Innovation Park at Hauppauge. And people tend to ignore business owners, but right at the beginning of this, so he said most of his line workers are Hispanic, and they come from some of the other boroughs to work here. Yep. And they were very scared because they realized people were getting sick very quickly. And he said, as he spoke to them, he realized they just are a more affectionate culture. They live closer. They're more intimate. And so that was all the things. And he was able to react very, very quickly in his business prior to any mandate that there be social distancing or anything else, to get them safe and comfortable, because he needed his workforce there and he needed his workforce healthy. And I think a lot of times, especially in healthcare, government and healthcare are aligned, but the business community is excluded from those discussions. And I think business owners have a whole lot to add as it relates to those discussions as well.
Well, I got to tell you, Joe, now you're making it personal, all right? Because I'm a, no, in a good way. Walker's Shortbreads, I am a fan. I'm a huge fan, and I'm gonna make an unabashed pitch. I love Nutella. So if you ever want to have Walker's Shortbreads and Nutella, it is awesome. But to your point, that's a fabulous example. What are you doing for cultural sensitivity? If you show up and you bring a whole slew of staff and nobody speaks a second language, and you're going to a facility that has a lot of people who speak Spanish as a first language, okay, that's not doing it the right way. One of the groups that we have internally is Northwell Direct, who I think you're familiar with. They go out and they're looking at businesses, and it can be for flu shots. It could be for COVID testing. but it's also a broader and a more holistic approach. What can we do in terms of wellness? What can we do in terms of nutrition? We work very closely with entities like Island Harvest and food and nutrition and diet and things like that, all of which matter. So I'm excited by that. And I do think because of my background in government, but having a very strong sensitivity for business, I would love to do that. Love to do that because we have a lot of employers, and you spoke eloquently to it. They're trying to do the right thing. They really are trying to do the right thing. And it doesn't really matter what the business is. People want to hire good people and they want to take care of them.
Yeah,
And
it's
here,
interesting because we've all been thrust into this dialogue that nobody in healthcare has ever had to have before, right? And I've been thinking about it a lot, and it's health and safety versus business, revenue, and profit. And how do you manage that fine line as a business owner? Now, if you think about it, healthcare systems, that's what they do every single day, right? Is we want to provide amazing service and save lives and make sure the community is healthy, but we have to generate revenue to be able to do so. And I think business owners want to do the right thing. They just are not sure what that right thing is. And then add the noise of politics and the media, and nobody really knows what the right thing is. So I think having folks like you be able, who are no BS guys, to be able to cut through and give us clarity is incredibly helpful at this point.
yeah, another component too, and I think this is a little bit more challenging, but sometimes it's the ever-changing nature of things. Now, the pandemic created a situation where you had to have flexibility, but too often rules were changing, whether it came from the Department of Labor, the Department of Health, Department of Transportation. If you went to all of your members and said, look, you don't have to love every rule that's out there, but I can guarantee you for the next 5 years, they're not going to change. That enables people to plan.
Right.
That gives a little stability, a little certainty. Here, you have to, in your own business, you're paying unemployment insurance, you're paying workers' comp, probably some disability, things like that. You're a professional firm. You still have to deal with those issues. So, yeah, I have always believed, and I think unfortunately government has not felt this way in New York. Businesses are trying to do the right thing. And even in spite of the fact that I work for a very large system now, small business is the backbone of our economy. Take Bayshore. The economic ripple effect that Southside has had is extraordinary. Restaurants, retail facilities, things like that. And by the way, all those practices that are outside. You go to your OBGYN practice, you go to your primary care, you go to a pediatric practice. They're all out there. And those are small businesses, yes, under the umbrella of Northwell, but you're right, it's all related. So, I'm excited by virtue of the fact that I think there is extraordinary opportunity to have a lot more of that type of involvement. And I'd like to think that's one of the reasons they were kind enough to ask me to join the team.
Yeah, I think so. So another issue that's sort of COVID related is we had the district attorney Tim Sini on a couple of weeks ago, and he spoke about the uptick in opioid use and during this entire time, and the
Mental health.
crisis that's going to have sort of moving forward. And so how do large healthcare systems like Northwell sort of process that and plan for that and help evaluate? That's going to be the next onslaught, I think, once this all calms down, right, is going to be that.
It was like a PTSD in a sense. There's going to be a lot of folks that are going to be suffering from the trauma that was COVID. Well, hopefully.
They used pills and other drugs to cope with it. It's another wave.
Yeah, there's no question that even internally, and it doesn't matter which health system, the extremists that these folks had to deal with and what they were involved in, the frontline workers, there's a lot of work through our HR department looking at counseling and providing intervention for people who need it, and they need it. Again, you read this stuff, there's been exposure to seasoned veterans and professionals who've never seen anything like this. So that's one part, that's ongoing, that's internal, but there does have to be recognition. And Peter's description of PTSD, I think, is spot on. So Joe, what you're speaking to is behavioral health, drug addictions and substance abuse, but also mental health. And I have a very keen interest in these areas. And I'm one that when I was a legislator, I was very readily willing to say mental health is a lot more challenging, because I always said, if you came in with a knee brace, or Peter came in with a cast on his arm, say, oh yeah, I broke my arm, or I just had knee surgery. Someone comes in and they have a mental health issue, it's not always so apparent. So I think that is inherent in terms of being a challenge. I'm not saying that people don't care, but I've always found that to be a little bit more challenging. In that area, government, whether it's state or federal, is going to have to change the way it views things. Behavioral health is extraordinarily important, and yet it is in many respects a financial disaster in so many different ways. The reimbursement rates are either de minimis or in some cases non-existent, and there are rules and regulations that adversely affect that. So the state of New York will say, yes, you have to have appropriate mental health care, and yes, you have to have appropriate substance abuse care. True, but how do you do that in COVID? How do you bring somebody into a facility? Those are challenges, but I think you take a system like Northwell, we clearly have our challenges in that area, and it's not, it is absolutely mission driven. Michael Dowling, and I know Steve Bello, who heads our Eastern region, he's my boss. We have had many, many conversations about this already. How do you do this? And how do you prepare for that mental health component? And
interestingly, there's a lot of digital health care companies that are
yes,
now very
yes.
hot. And Kaiser Permanente utilizes one of them in their mental health. They did a pretty big contract with this one company, and they allow them to do essentially coaching and therapy through digital interface, much like we're doing, I guess, here. But can you imagine just two people, doing a private counseling session? You know what? Every little bit helps. And if you're in real need and you're really on your, at the end of your rope, a therapist, a professional therapist through a digital interface will make a difference.
Peter, you are 100% right. I agree with you wholeheartedly. Part of the challenge is insurance companies don't want to provide adequate reimbursement. They say if you're not going to an office, it's not the same thing. I dare say, to your point again, if you talk to somebody and they are isolated at home for whatever the reason may be, a telehealth visit could actually be something that saves their life. Saves their life.
Yeah. And
why shouldn't it be adequately reimbursed? Is it worthy of discussion? Sure. But that going back to Joe's point and dovetailing on what you said, that's critical, and that's going to be a debate that is going to go on. And I really think that government. Oh, by the way, this is not new. It's not a nascent thing for me in the sense that I'm now at Northwell. This is kind of what I thought when I was serving in government. So as we talked about a deeper and enhanced respect for science and funding research, this has got to be the same kind of thing. Everybody knows these services are critical, but no matter what health system, including Northwell, if you don't have appropriate or adequate reimbursement, that's going to create havoc within a system that's already replete with challenges.
Yep. So I can't believe that our hour is up. This has been an amazingly informative discussion. John, we always give you the last word. Our rule is it has to be optimistic. So let us hear what your final thoughts are on this subject.
I'm so grateful to you and to Peter. And Peter, I will follow up with you independently, and I want to thank you for your service vis-a-vis Huntington Hospital. I believe in people. I believe in human capital, and we can invest in buildings, but if we don't invest in human capital, shame on us. In a short time I've been here, I am overwhelmed in a positive way at the talent and the capabilities and the dedication of the people that work here. And I think that goes across healthcare, but now I'm part of this team, and I can tell you, Joe, I'm looking right at you. I wouldn't hesitate to say to you, come to any one of our facilities and you will be well taken care of. And more importantly, if you need to send your family, you'll get the same thing. So this is a cool endeavor. I don't feel like, if I sound like I'm 12 years old, I'm okay with that. This is a very unique opportunity. And I just hope that I want to do a lot more work with the HIA. I think we have great capacity to do that. And I have deep respect for the work that people like Peter do. So listen, I've always woken up in the morning, the glass to me is always half full. And that's how I start. So I am absolutely optimistic.
Hey, quick question from one of our viewers, John, is being your seat hasn't been filled yet, who should constituents in that district turn to with questions?
Oh no, they can absolutely. The office is open and operational. It's been open since I left. It's the same number. It's right in Smithtown, 631-361-2154. The entire staff is there. They've been fielding questions, and they are absolutely open full-time for constituent service. And you give me a chance to tell you, I am so deeply proud of the people that I had a chance to work with. They're really, really good people.
Yeah, great team there. You always had a great team there. It's great stuff. Peter, your final thoughts?
Well, you know what? I'm just jazzed that we have this kind of talent pool here on Long Island, where we could have someone who spent 30 years of his career in government and now is able to pivot, not leave Long Island, stay here and pivot to a new initiative that's going to help so many people. John, and we're very excited about your new role. Thank you.
Thank you very much.
Yeah, I felt the same way. I was super happy that we kept you here on Long Island. You know that I love you, man. You know that. So, folks, coming up, we have September 22nd. We have Kristen Jarnigan of Discover Long Island, who's going to talk about the battered travel and tourism industry here on Long Island, which we had made so much progress on, and Kristen's done a great job trying to get us at least to this point. October 6th, Dr. James Lentini, who's the new president of Malloy College, and speak about higher education and the challenges in getting our educational institutions open. And October 13th, Diane Hatton of Brookhaven National Lab, who's going to be discussing the electron ion collider. So we got 3 more great shows coming up. But John, thank you so much for your time, for your service, for staying on Long Island. Please give our thanks to Michael and the team for the great work at Northwell. We are very proud of you guys all. We really are.
Thanks so much. Really appreciate it. Have a great day.
You too, John. Thanks so much.
Thanks, Joe. Thanks, John.